Rheumatoid arthritis, a condition affecting millions, cannot be effectively managed if certain foods remain in one's diet. It is vital to understand the significant role that diet plays in either exacerbating or alleviating symptoms. This essay will explore 25 foods that can aggravate inflammation and potentially worsen rheumatoid arthritis, including sugars, saturated fats, processed snacks, and certain vegetables. Each food item discussed has specific implications for joint health and overall well-being. The reasons these foods might trigger inflammatory responses will be examined, alongside practical tips for making healthier dietary choices. By understanding the impact of food on inflammation, individuals with rheumatoid arthritis can take proactive steps to feel better. Sugar, when consumed in large quantities, can increase inflammation by triggering the release of inflammatory cytokines. This protein plays a crucial role in the body's immune response. High sugar intake can also lead to weight gain, adding stress to the joints and exacerbating pain associated with rheumatoid arthritis. Foods and beverages high in sugar, such as sodas, candies, and pastries, should be limited to manage symptoms effectively. Reducing sugar intake can decrease inflammatory responses, improving joint health and reducing pain. Saturated fats, primarily found in red meat, butter, cheese, and full-fat dairy products, contribute to inflammation, worsening rheumatoid arthritis symptoms. These fats increase cholesterol levels, leading to plaque buildup in arteries and higher cardiovascular disease risks. Saturated fats also trigger the production of pro-inflammatory cytokines, exacerbating joint inflammation and pain. Reducing the intake of saturated fats and replacing them with healthier options, such as olive oil, nuts, and avocados, can manage inflammation and improve overall health. Trans fats found in processed and fried foods are particularly harmful to those with rheumatoid arthritis. Created through hydrogenation to extend shelf life, trans fats promote the production of inflammatory cytokines, increasing heart disease risk and exacerbating joint pain and swelling. Common sources include margarine, shortening, commercially baked goods, and many fried fast foods. Eliminating or significantly reducing trans fat intake is crucial for managing symptoms and improving health. Refined carbohydrates, such as those in white bread, pastries, and many processed snacks, contribute to inflammation and exacerbate rheumatoid arthritis symptoms. These foods are stripped of natural fiber and nutrients, causing rapid blood sugar spikes that trigger inflammatory cytokines. This rapid breakdown into sugar can lead to weight gain, placing extra stress on already inflamed joints. Replacing refined carbohydrates with whole grains, fruits, and vegetables rich in fiber and nutrients helps maintain stable blood sugar levels and reduce inflammation. Excessive salt intake can aggravate rheumatoid arthritis symptoms by promoting water retention and increasing joint swelling. High sodium levels can elevate blood pressure and strain the cardiovascular system, complicating health for those with rheumatoid arthritis. Processed foods, canned soups, fast foods, and salty snacks are common high-sodium sources. Reducing salt intake can decrease inflammation and fluid buildup in the joints, alleviating pain and discomfort. Using herbs and spices instead of salt can be a healthier alternative. Omega-6 fatty acids, essential in small amounts, can promote inflammation when consumed excessively, particularly harmful for those with rheumatoid arthritis. These fats are found in vegetable oils such as corn, safflower, sunflower, soybean, and cottonseed oil, as well as processed and fried foods. An imbalance between omega-6 and omega-3 fatty acids can exacerbate inflammation. To manage symptoms effectively, balancing omega-6 with omega-3 fatty acids found in fatty fish, flax seeds, and walnuts is crucial. Red meat, including beef, pork, and lamb, is high in saturated fats and can exacerbate inflammation, making it problematic for those with rheumatoid arthritis. It contains advanced glycation end products, AGEs, which form when meat is cooked at high temperatures, triggering inflammation and oxidative stress. Limiting red meat consumption and opting for lean protein sources such as poultry, fish, legumes, and plant-based proteins can reduce inflammation and support overall health. Processed meats, such as sausages, hot dogs, bacon, and deli meats, are high in preservatives, additives, and unhealthy fats, worsening inflammation and rheumatoid arthritis symptoms. These meats typically contain high sodium and nitrates, contributing to increased blood pressure and inflammation. Limiting or avoiding processed meats and choosing healthier protein sources can manage symptoms and improve health. Gluten, found in wheat, barley, and rye, can trigger inflammation in some individuals with rheumatoid arthritis, particularly those who are sensitive or intolerant. Gluten sensitivity can exacerbate symptoms, making it difficult to manage the condition effectively. Eliminating gluten from the diet can lead to significant improvements in symptoms and overall well-being for those with sensitivity. Dairy products such as milk, cheese, and yogurt can exacerbate inflammation and worsen symptoms for some individuals with rheumatoid arthritis. While not universally problematic, dairy contains proteins that may trigger an inflammatory response, contributing to joint pain and swelling. For those suspecting dairy intolerance or sensitivity, eliminating or reducing dairy consumption may help alleviate symptoms. Alternative sources of calcium and vitamin D: fortified plant-based milks, leafy greens, nuts, and seeds. Alcohol consumption can exacerbate rheumatoid arthritis symptoms and interfere with effective management. Alcohol promotes inflammation, worsening joint pain, swelling, and stiffness. It can also interact with medications, potentially reducing their effectiveness or causing harmful side effects. Limiting or avoiding alcohol can reduce inflammation and optimize treatment outcomes. Fried foods, high in unhealthy fats, can contribute to inflammation in individuals with rheumatoid arthritis. Typically cooked in oils high in trans fats, fried foods lead to elevated cholesterol levels, weight gain, and insulin resistance, worsening symptoms. Reducing or avoiding fried foods and opting for healthier cooking methods can help decrease inflammation and support better joint health. Artificial sweeteners, such as aspartame, saccharin, and sucralose, can potentially trigger inflammation and worsen symptoms for individuals with rheumatoid arthritis. Some studies suggest artificial sweeteners may disrupt gut bacteria balance, impacting immune function and inflammation regulation. Reducing or avoiding artificial sweeteners and choosing natural sweeteners in moderation can help support a balanced diet and minimize potential inflammation triggers. Monosodium glutamate, MSG, a flavor enhancer, can trigger or worsen symptoms for some individuals with rheumatoid arthritis. MSG sensitivity may cause joint pain, swelling, and inflammation. Avoiding or limiting foods with added MSG and opting for homemade meals with fresh ingredients can help manage symptoms effectively. Aspartame, an artificial sweetener, can trigger inflammatory responses and worsen symptoms for some individuals with rheumatoid arthritis. Reducing or avoiding products containing aspartame and opting for natural sweeteners can help minimize potential inflammation triggers. Refined sugars, found in candies, pastries, sodas, and other sweeteners, can exacerbate inflammation and worsen symptoms for individuals with rheumatoid arthritis. These sugars cause rapid blood glucose spikes, triggering inflammatory cytokines. Limiting intake of foods high in refined sugars and opting for healthier alternatives can help stabilize blood sugar levels and reduce inflammation. High-fat dairy products, such as whole milk, cheese, and full-fat yogurt, can exacerbate inflammation and worsen symptoms for individuals with rheumatoid arthritis. Reducing or avoiding high-fat dairy products and choosing low-fat or non-fat options, or dairy alternatives, can help alleviate inflammation and improve joint health. Processed snack foods, high in unhealthy fats, sugars, and additives, can exacerbate inflammation and worsen symptoms for individuals with rheumatoid arthritis. Choosing healthier snack options such as fresh fruits, vegetables, nuts, and seeds can reduce inflammation and support overall well-being. Fast food, high in unhealthy fats, sugar, and sodium, can exacerbate inflammation and worsen symptoms for individuals with rheumatoid arthritis. Minimizing or avoiding fast food and choosing homemade meals with fresh ingredients can help reduce inflammation and support better joint health. Certain vegetable oils, high in omega-6 fatty acids, can contribute to inflammation and worsen symptoms for individuals with rheumatoid arthritis. Reducing consumption of oils high in omega-6 fatty acids and choosing healthier fats can help manage symptoms effectively. High-sodium foods, such as canned soups, processed meats, salty snacks, and fast foods, can exacerbate symptoms for individuals with rheumatoid arthritis. Reducing consumption of high-sodium foods and using herbs and spices instead of salt can lower sodium intake and reduce inflammation. Caffeine, found in coffee, tea, energy drinks, and certain medications, can potentially exacerbate symptoms for individuals with rheumatoid arthritis. Moderating caffeine intake and choosing decaffeinated beverages or herbal teas can help manage symptoms effectively. Certain nightshade vegetables, such as tomatoes, peppers, potatoes, and eggplants, contain compounds that may trigger inflammation and worsen symptoms for some individuals with rheumatoid arthritis. Paying attention to individual responses and consulting with a healthcare provider can help determine if avoiding nightshade vegetables is beneficial. Margarine, a common butter substitute, often contains trans fats that can contribute to inflammation and worsen symptoms for individuals with rheumatoid arthritis. Avoiding margarine and choosing healthier fat sources can help manage symptoms effectively. Processed baked goods, high in sugar, unhealthy fats, and refined carbohydrates can exacerbate inflammation and worsen symptoms for individuals with rheumatoid arthritis. Limiting or avoiding processed baked goods and choosing homemade treats with healthier ingredients can reduce inflammation and support overall well-being. Understanding the impact of diet on rheumatoid arthritis is crucial. By identifying and avoiding foods that exacerbate inflammation, individuals can better manage their condition and improve their overall quality of life. Incorporating anti-inflammatory foods and minimizing intake of inflammatory triggers can support joint health and reduce symptoms.